The treatment of acute exacerbations is generally not very good. Preventative strategies include the implementation of antifibrotic therapy prior to the development of the acute exacerbation. Nintedanib specifically has been shown to delay the time to acute exacerbation, and there's also evidence for pirfenidone from some of the older Japanese studies that this might have a favorable impact on the subsequent development of acute exacerbations. Typically, what is implemented once a patient has an acute exacerbation include various medications that have been tried, but we don't have any solid evidence that any of these drugs actually work. We'll use steroids. Cyclophosphamide has been used. Cyclosporin has been used. Hemofiltration or hemoperfusion has been used. Rituximab, tacrolimus, various things have been used, but there's no good evidence that any of these have any effect. We will also use high-dose steroids. There's no good guidance about this, but we all kind of do it. Whether this helps or not is very uncertain. Some patients are candidates to go into mechanical ventilation, but generally mechanical ventilation as well as ECMO is only recommended for those patients who are being bridged to transplantation. If a patient with IPF develops an acute exacerbation requiring mechanical ventilation, then the prognosis is typically quite dismal, and we'll usually talk to the patient and or their families about more comfort care measures rather than going the route of mechanical ventilation. But definitely ECMO should only be reserved for those patients who are being bridged to lung transplantation. Don't forget to also address comorbidities in the context of patients who present with acute exacerbations. I mentioned that things such as coronary artery disease, heart failure, VTE might all manifest with increased shortness of breath, so don't forget about that. Don't forget about providing psychosocial support, not only for the patient, but also for the family as well. It always helps to have a multidisciplinary care team in place who help to provide care to the patient and to take care of all manifestations of the disease, as well as some of the downstream complications that can ensue in patients who have IPF, especially as they head towards the end stages of their disease. It's very helpful to have palliative care and hospice services involved as well.